One of the most common questions that I'll get after someone clears their Buffalo concussion treadmill test is, can I keep exercising? It baffles me, but my answer is always a resounding yes. The problem is, and the reason this question gets asked, is because most people, particularly non-athletes, so folks who don't have a competition or a sport or something they're trained for, they stop moving once they're cleared. And this is actually one of the worst things that you can do for your overall health. Hi, I'm Dr. Mark Heisig. I am a concussion specialist. I've helped hundreds of people every year, from professional athletes to non-athletes, recover from concussions and regain control of their health. In this video, I'll explain why stopping exercise after you're cleared from concussion is one of the biggest mistakes you can make, and how staying active can dramatically reduce your risk of all kinds of diseases, even death. And I'll talk about how to get that nebulous 150 minutes of weekly activity that your body needs. We'll talk about how to do that. So let's dive in. So the mistake is stopping exercise after your recovery. So after a concussion, in the initial stages, in the acute stages, and post-concussion, movement is essential for recovery, but once cleared, many people stop exercising altogether. And this isn't just bad for your brain health, it's bad for your body. It's just not good. We were meant to move. Despite being made to move and having bones, joints, muscles, lungs, heart, and all these beautiful things that our body has, studies show that about 50% of our waking hours are spent sedentary, just sitting, and less than 1 in 4 US adults gets 300 minutes of activity per week. And we're talking about purposeful activity, not just exercise, but just getting about, moving around, walking around, just doing something on purpose. That's only 42 minutes a day. And yet most of us don't even hit half of that. Why does this matter? Because prolonged sitting paired with low activity levels increases your risk of heart disease, cancer, metabolic disease, and even an early death. So how much exercise do you really need? This is where that 150 minutes comes in. If you look at the CDC, the World Health Organization, the American Heart Association, the American College of Sports Medicine, the National Academy of Sports Medicine, if you look at all these organizations with alphabets for their acronyms, you're gonna find that they recommend 150 minutes of moderate activity per week, or 75 minutes of vigorous activity per week. So let's break that down. Here's what that looks like. Moderate activity is something like brisk walking, light cycling, water aerobics. You're breathing faster, like you're definitely exercising, but you're still able to talk. This is that classic zone 2 training that Dr. Peter Attia has made really popular over the past few years. This is about 65 to 75% of your estimated maximum heart rate. That's moderate activity. Vigorous activity, this is when you're actually running, you're actually swimming, you're doing a HIIT workout, you're breathing hard, and you're only able to get out a few words, you're kind of gasping, you're definitely doing some vigorous activity. This is above 75, really we're talking like 85 to 95% of your heart rate maximum. Quick side note, if you want to calculate your heart rate max, it's really simple. Take 220 and subtract your age. So for example, if you're watching this and you're 30 years old, your heart rate max is about 190 beats per minute, if we were to guess. Moderate activity for you is going to be ballpark 125 to 145 beats per minute. That's your zone 2. And then vigorous activity is going to be between 150 and 170 beats per minute. And you'll see that that's much harder to maintain for long periods of time. Now, if you're not ready for 150 minutes a week, start small. Something is better than nothing. Moving is better than not moving. When we look back a couple of years, there was a big JAMA study that found that adding just 10 minutes a day of daily movement, so like going for a 10-minute walk, can prevent 110,000 deaths annually in the United States. If we took that 10 minutes and made it 20 minutes a day, that reduces deaths by 13%. If we went 30 minutes, that reduces it by almost 17%. What if we replaced sitting with movement? So if we swapped 1 hour of sitting with 1 hour of walking, and if we got one of those walking, for our standing desks, we would reduce all-cause mortality by 22%. If we replaced 1 hour of sitting with 1 hour of vigorous activity somewhere else in the week, we would get a whopping 31% reduction in all-cause mortality and an even bigger 64% reduction in cardiovascular mortality, meaning your chance of dying of cardiovascular disease just went down 64% because you added an hour of vigorous activity instead of sitting. So whether it's walking, cycling, dancing, sports, something else, movement has massive changes to your health. So after concussion, you're not an athlete, you're not used to training, you're not used to exercising. How do you make it a habit? The first thing, and this is cliche, it's kind of cheesy, don't make exercise a punishment for something you did, for something you ate. Never do that. Really adopt the cheesy cliche mindset of like, I get to exercise. Like I have this body, I get to do these things. I think it's a shame and like a disservice to yourself if you don't actually try to challenge yourself from time to time. How fast can I run? How high can I jump? How much can I lift? Don't do things dangerously and jump into trying to PR something like over 300 pounds if you don't lift, but gradually try to challenge yourself. You've got this amazing body, use it. So less cheesy, less cliche. set a simple goal. So if you're trying the 150 minutes, start trying to move for 22 minutes of moderate activity every day. Get a watch, get a Fitbit, get something that can track your heart rate, or just use the litmus test of, can I maintain a phone conversation where they know I'm exercising, but I could still maintain the conversation? And yes, I'm old because I did this. The other thing is, if that's too much, just aim for 10 minutes of activity. Going back to that study before, we could cut over 100,000 deaths annually in the US if people just moved 10 more minutes a day. Again, you can track your heart rate or your steps. So your watch tracks, a lot of watches now, Whoop, Polar, Garmin, Fitbit, they all can track your heart rate, but they can also track your steps. So if you can't get into that moderate intensity zone or you don't want to, just look at your daily step count. Aim for 6,000 to 10,000. I personally aim for 8,000 to 12,000. There's no real upper limit on the benefits. More steps, good for you. And as much as you can, replace sitting with movement. So stand during phone calls. I pace anytime I'm on the phone. Walk around the block, do light stretches. Just a note on the pacing. That's not because I'm like neurotic and trying to move more. That's just because I'm neurotic for other reasons. I just pace. I just don't sit still. Drives my wife nuts. Last thing is have fun. So pick activities that you enjoy. Walking, swimming, dancing, pick up hockey, jiu-jitsu, something that you really enjoy that gets you moving. Again, don't attach it to a punishment. Attach it to like an expression of movement and enjoying moving and using your body. It doesn't have to be perfect. It just has to happen. Don't get bogged down by, there's a lot of social media videos and Instagram, and I see it just because of the world that I'm in, where it's like, don't do your squats like this. If your foot does this, it's a problem. If blah, blah, blah. Like, just move. Crowd out the noise, just move. Movement is better than not moving. So to recap, the number one post-concussion, meaning after you've been cleared mistake, is stopping exercise after your recovery. By moving just 10 minutes a day or aiming for 150 minutes a week, you can improve your health, lower your risk of multiple diseases, and even add years to your life. That's pretty cool. So if this video helped you, inspired you, did something cool, hit the like button, go ahead and subscribe, hit the bell, do all the YouTube things. It helps me out. It's free for you. I always appreciate it. If you want personalized support for your recovery, you can check out my concussion reset course. You can set up an intro call. But until next time, I'm Dr. Mark. Thank you for watching.